Menoflavon, mature with confidence. Menopause is typically experienced by women ages 45 to 55 who have no menstruation for the last 12 months or more. When menopause occurs, women experience changes in their estrogen levels, follicle-stimulating hormones, and luteinizing hormones. There are three types of menopausal symptoms: the vasomotor symptoms, which includes hot flushes, night sweats, dizziness, and headaches; urogenital symptoms, such as vaginal dryness, pain during sex, and decrease in libido; psychological symptoms, which are depression, nervousness, palpitation, and lack of concentration. Menoflavon contains a patented formula of red clover extracts and is backed by more than 50 clinical studies. Menoflavon helps to reduce mild to moderate symptoms. Menoflavon has a standardized formula of 4 isoflavones which have estrogenic-like properties. They are genistein, daidzein, biotin A, and formulatin. It improves bone mineral density and the lipid profile. There is no known hepatic toxicity and adverse side effects. Patients experience menopausal relief in just 3 to 8 weeks. There are 4 isoflavones in Menoflavon, which are biotin A, formulatin, genistein, and daidzein. This leads to a decrease in all 3 menopausal symptoms. These isoflavones have a higher binding affinity for estrogen receptors beta, which can be found in the bone, the brain, and the heart tissues. These isoflavones have a lower binding affinity for estrogen receptors alpha, which can be found in the breast and the endometrium tissues. It has been found to have no adverse effects on the endometrium thickness and the mammographic breast density, which is the established risk factor for breast cancer. Menoflavon also has a high amount of polyphenols. This provides additional protection against cardiovascular events. For women taking Menoflavon, hot flushes reduces by 84.9%. Vaginal dryness reduces by 46.8%. Depression reduces by 68.9%. There are a number of common herbal remedies for menopausal relief available. We will be focusing on 3 of them for further comparison. They are red clover, soy, and black cohosh. There are 4 isoflavones found in red clover, 2 isoflavones found in soy, and none found in black cohosh. For reducing hot flushes, red clover is 2 times more effective than soy, while there is poor evidence that black cohosh reduces hot flushes. Black cohosh is also known to cause liver toxicity and may not be suitable for long-term use. Mammographic breast density is an established risk factor of breast cancer. A 3-year clinical study was done in this case to show whether red clover affected the changes in breast density using red clover extract and a placebo as the control. The study showed steady decline of breast density for premenopausal women who took Menoflavon and the placebo. This was also true for menopausal women in both control groups. Both the premenopausal women and the menopausal women show no statistical or significant percentage difference in breast density changes. Therefore, Menoflavon is safe for women with a family history of breast cancer. To check whether a patient is going through menopause, patients should go through a general health assessment. A menopause rating scale can be used to assess the severity of menopausal symptoms. Once the patient completes the menopause rating scale, the total score will determine whether the patient has mild, moderate, or severe menopausal symptoms. If a patient has mild to moderate menopausal symptoms, doctors can recommend patients to take Menoflavon. For severe symptoms, we have to first determine whether the patient is averse or contraindicated to take HRT. If the patient is averse to HRT, then non-HRT medication with Menoflavon can be prescribed along with making lifestyle changes. If the patient does not have an adverse reaction to HRT, then HRT can be prescribed under the conditions that the patients are aware of the risk when taking HRT. Lifestyle changes must also be made in this case. However, HRT has risks as previously mentioned, and if prescribed, is not recommended to take for more than 5 years. As symptoms can still persist after HRT treatment, Menoflavon can safely be prescribed as a step-down care. For more information, and if you would like to obtain our menopause rating scale, please contact us at sales@medgen.com or call us at 6398-5822. Our medical sales representative will be more than happy to serve you.